Gentlemen, welcome once again to another episode of the Think Clinical Podcast. My name is Hamza. It's amazing to be here. Today's episode is going to be around how you create digital first healthcare. How do you create digital first or virtual first healthcare? How do you build digital patient experiences that really stick? Okay, and so when you look at companies like Netflix, they didn't kill Blockbuster by being cheaper. They killed them by being more convenient. So today's healthcare founders face the same choice. You either have to evolve into a digital first experience or watch patients who would actually go to competitors because they decided to be digital first. This is the economy we are in. My name is Hamza Asuma. This is a Think Clinical Podcast. Remember to subscribe, like, and share. Today's episode is going to be a really short one, hopefully. But I want to kick this off by making sure that you understand the difference between adopting a digital first approach and doing a digital added approach. Now, when you talk about digital added approach, you're talking about people bolting virtual visits or virtual platforms onto their traditional practice. That's digital added. That's what most people are doing now, and they think they are being digital first. No, digital first approach is you are designing your entire patient journey around convenience. That whole journey is designed around convenience. You're not bolting all these virtual tools on your already existing traditional platform. So when you look at what I call the Amazon effect in healthcare, patients now expect one-click booking. Patients now expect transparent pricing, and patients now expect instant access to their information. Three things. So if you are creating a digital first approach, you're looking at the whole patient experience. You're building the whole entire journey around convenience. You're making sure that at one click they can get a booking. They have transparent pricing and they have instant access to their information. So this backed by data. 75% or 78% want same day appointments. That's a fact. 78% of patients. How do you do that? If you do not build the whole patient journey around convenience, it's going to be difficult when you add or bolt these virtual platforms on your traditional system. 65% will switch providers for better digital experience. That's a fact. This is research by Deloitte. And 90% expect appointment booking outside of business hours. So when your office is not opened and you do not build your whole patient journey on convenience, nobody is going to be there to have this done. So patients should be able to get appointment booking outside of business hours. I should be able to sit in my home on a Saturday and do my booking online and be able to get in and see a doctor. Now, when we look at all this, what you need to be thinking about is what we call the async care model or the asynchronous care model. The async care model, now you're now looking at real time. You're looking at a non-real time medical interaction through secure messaging, through photo consultation, and mostly through AI trigger responses. So you're looking at three things, right? So the opportunities here for async care is that and then these are the opportunities. You can look at it from the privacy side, which is how do you do your digital intakes? How do patients complete their forms? Is there a way for them to do it before they come in? Symptom checking, care planning. These are the pre-visit preparations that these async care models would allow you to do. Between patient visits, checking could be asynchronous, medication adherence, and then progress tracking. These fall under the async model. And then we look at post-visit. When you look at recovery monitoring, we're looking at questions, you're looking at care plan adjustments. These will fall into that. So how do you implement this framework? And I'm going to give you very simple steps that you need to do. As I said, this is a very short episode, so you need to listen. One, you need to start with the simple stuff. Photo consultation for dermatology, for instance. Hey, this is what is wrong with me. Okay, send me a photo. Like if you're a dermatology clinic, these are simple ways you can start. The whole to scale to the complex procedures. Now you can go or migrate to chronic conditions, because now you can monitor and can do medication management through these platforms, and then you can go then the next level, which is more advanced AI powered symptom triage and more of a care recommendation. So this is how you actually get yourself into that point. And whenever you start using these virtual platforms, always think about a subscription model. Always think about how to build a subscription model around these systems, because the moment you start looking at digital first approach where your patient journey is all centered around convenience, start thinking from a founder standpoint and from a patient experience or patient consistency standpoint. Start thinking about the subscription model. What does that do for you? As a founder, it predicts your revenue. You have predictable revenue for yourself. You know how much to expect based on the number of subscribers you have in each tier. And I can give you some examples of like different tiers that you can use to look at this. Secondly, you have consistent care for patients, because if I'm on a subscription model for, let's say, my chronic condition that I have to get consultation and medication and monitoring for, I will show up and I will do it. So I have consistent care for my patients. And then you have lower per patient interaction costs. This is important. So whenever you're thinking about doing digital first approaches, always think about a subscription model. And once you get that subscription model in place, make sure that it's in tiers, because not every patient can afford the same level of subscription. So you can look at some form of basic access where people get virtual consultations, they get access to their digital records, and they have basic monitoring. You can look at the premium care where people get same day visits if they have to come in and see you. There's some care coordination that's associated with it, and there's some health coaching. And you can look at the Concierge Plus level where you have 24/7 access. Patients have 24/7 access. There's annual executive physicals. There's family coverage. You are providing services at each level that really helps everybody do that. So let's say, for instance, a psychology practice could say, okay, patients, you should pay $15 a month, all right? But when you look at this as a premium, that could also translate into saying, okay, now I would have patients probably pay $200 a month. $200 at the go, right? But then you have to make sure that you are providing the specific services that patients are going to really appreciate within each tier and within each subscription model that you have. So when you are looking at anything that has to do with digital first approach, especially when it has to do with patient care, the continuity of care, the consistency of care, as well as the health of your business is also important. You have to start looking at how you are going to have systems in place to be able to keep this consistently going and being predictable, especially for your patients, for most of it. Now, I'll go again to talk about network effect, which I've talked about in my previous videos. But when you look at these platforms, diabetes support groups with shared glucose monitoring, that's where you can create that network effect. You can look at fitness challenges with integrated wearable data. That's where you can have those network effects. Peer medication adherence accountability, people hold each other accountable for stuff. So these digital first approaches really improve convenience. They also have some added effects, some network effects that you can look into. So that being said, you have to make sure that the future of healthcare, and you have to make sure and understand that the future of healthcare isn't just virtual. It's more about convenience. It's about continuity. It's about community driven approaches. So when you're a founder and you start building digital first approaches, don't just add a service line. They just create competitive modes. Start thinking like a tech company that happens to do healthcare, not a healthcare company that is doing tech. Ladies and gentlemen, this has been another episode of the Think Clinical podcast. Thank you so much and have a beautiful day. Remember to subscribe, like, and share. We'll see you in our next episode.